Hi there, it's Jordan. This week I have the clavicle and scapula to review with you. So let's get started. Alright, so the clavicle and the scapula. So these two bones are making up the pectoral or the shoulder girdle, which is part of the appendicular skeletal system. The clavicle is straightforward. So let's start out with the sternal end here. So the sternal end you can see is more rounded. There's quite a bit more contact area, and this is where the clavicle will interact with the sternum, which is on the midline of the body. Next, on the opposite end, we have the acromial extremity or the acromial end. So the acromial end you can see is much more flat, much more broad. So the acromial end is actually going to be associated with the acromial process or the acromion of the scapula, which we'll get to in a minute. But again, much more flat. And then finally here we have the tubercle. So the tubercle is a small, rounded, bony projection coming here from the clavicle. Very straightforward though. And I threw in a little x-ray here. I think it's kind of nice to see the real world view of it. So outlined over here, I have the same image. I just wanted to show you the original. So we have the acromion, acromial end over here. So this is more lateral, also outlined in yellow. And then we have the tubercle outlined in pink. And then finally we have the sternal end, which it's kind of cut off here, but you can just barely see the beginning of the sternum here. So this is medial, and it makes sense then that this would be the sternal end. And just for reference also, this is the humerus, which is the arm bone, and then you can just faintly see the the scapula. Once you see it, you can't unsee it, but there it is. I just roughly outlined it for you, okay? And that's an anterior view. Moving on to the scapula. So the scapula, I think, is an intimidating bone for most new anatomists just because there's so much going on with it. But really, once you know a couple of terms, and if you know your directional terms, you're going to be just fine. So starting out here with the superior border. Superior, again, that's a directional term meaning above. So this would be the superior border. Next, we have the medial or the vertebral border. So that's going to be the border that's closest to the vertebra or the backbone. And then finally here, we have the lateral or the axillary border. Remember, axilla is referring to the armpit, so it makes sense that the lateral or axillary border would be the border closest to the armpit here. Okay. And then we have a couple of angles and a couple other little terms to know here. So the superior angle, again, just know your directional terms, superior angle, and then the inferior angle down here. Moving on to the scapular notch, which is just this little bit here that's kind of been eaten out, but the little scapular notch. And then there's the neck of the scapula. There is some variation if you go and look it up yourself. There's like a surgical neck of the scapula, there's an anatomical neck of the scapula, so just know that it's roughly in this area here. All right, and then our last set of terms here for the scapula. First, like I said, if you know one or just a couple of structures, you will do so much better, and just combine them with your directional terms and you'll really have a good idea of what's going on. So starting out here with the spine of the scapula, sticking out right here, and this is going to be on the posterior aspect. So if you can imagine laying down on your back, your spine of scapula would be closest to the ground, between the ground and your skin, of course. So spine of scapula, and then remember our directional terms, supraspinous fossa, supra meaning above, and a fossa is a shallow depression in a bone. So that would make sense that this is the supraspinous fossa, above the spine. So then it would only make perfect sense if there's a supra, then usually there's an infra. So the infraspinous fossa is just below the spine of the scapula. Infraspinous fossa down here, which is more inferior. Next is the subscapular fossa. So subscapular actually meaning under or deep to the scapula. So again, we were just working on the posterior aspect of the scapula, and now we're looking at the anterior aspect of the scapula. So this is going to be the surface that would be closest to your ribs. So, subscapular fossa, and it's this whole entire thing here. And then we have a couple of little processes to know here. So the first one we have to know is the acromion process. And you can see it in both views, but it's going to be the larger projection coming off of the spine of the scapula. Now, the cool thing about the acromion actually and about the coracoid process is that they actually have names that are tracing back to Greek language. So the acromion, acro, is referring to the highest point. So if you can kind of think of the Acropolis, you know, the big place on the hill, acromion is the highest point of the shoulder. Omos is actually stemming from the Greek word for shoulder. So acromion, highest point of the shoulder. You'll be able to appreciate that better in a couple other images. And then here we have the coracoid process. And it is important that it's coracoid, not coronoid. That's a different one. So the coracoid process is just this little process kind of stemming up here. And cora is actually referring to the Greek word for raven. So it's almost saying that this is the raven's beak. The raven's beak kind of peeking up off of here. It almost looks a little bird-like, if you can appreciate that. Moving on, our last set of terms here is the glenoid fossa, or the glenoid cavity. So this is going to be making up part of the glenohumeral joint. So that's also known as the shoulder joint. So that's going to be the articulation point between the scapula and the humerus. So you can imagine the head of the humerus resting in here really nicely. So if this is the glenoid fossa, it makes a lot of sense that this would be the supraglenoid tubercle. Supra meaning above the glenoid fossa, which we just identified. Coming down here, we have the infraglenoid tubercle. And these will be really important, again, once we get to muscles. Okay, and this is a lateral view, so this is like if you're looking at your friend directly from the side, looking at their shoulder. Okay, and you can kind of appreciate a little bit better here. Remember how acromion, or the acromion process, was the highest point of the shoulder? You can see that a little bit better. And then I threw in a radiograph again because I think it really helps to see the real-world application of these things. So you can see I'm outlining the clavicle right now, coming in, so sternal end of the clavicle associated with the sternum coming right down here through the midline of the body. Okay. Next is the acromion process, or the acromial end, the acromial end of the clavicle. And then if you can see your scapula, I am outlining it right now. It's very easy then to kind of see all of your borders, right? The vertebral or medial border of scapula, the axillary border of scapula, and then the superior border of the scapula coming up right through here. We have our highest point of the shoulder, right? The acromion process. Coming down here to the coracoid process, which is kind of overlaid with other bones and tissues, but you can see it right there. So that's that raven's beak. And then the glenoid fossa. So the glenoid fossa, remember, is going to be the articulation point with the humeral head, really nice and rounded there. And then the supraglenoid tubercle would be here. Infraglenoid tubercle would be here. Okay. And the scapular notch is here. And the scapular neck would be roughly there. Okay. And then finally, inferior angle and superior angle of the scapula. I hope this video was helpful. If you have any feedback for me or anything you want to talk to Professor Craig about, please contact her, and I am offering virtual office hours from 8 to 9 p.m. Thank you for watching, and I hope you've enjoyed it. Thanks!